We'll just give everyone another minute to join. I know that the mayor is running a couple minutes late. He'll join us after. Dr. White, we have interpretation in Spanish.
Yes, we do.
Okay. Thank you. Do I need to make the announcement, Ms. Diaz-Baez? She was there, so. Okay.
Yeah, she's already on the channel, so no one else can hear her except if they're on that channel.
Okay. Sounds good. All right, well, I will call the meeting to order. There's 5 of us on, so I think we're okay to start. It's 5:33. So we can get started. Dr. Yarborough, would you lead us in the Pledge of Allegiance?
Yes.
Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. And we'll start with public participation. Dr. Joyner and Dr. White.
I'm ready. You will have 3 minutes. When your 3 minutes are up, I will say time and you should complete your sentence. Thank you.
Good evening. Our first speaker is Melody Gallagher.
Good evening. Can everyone hear me?
Yes.
Okay. So good evening. My name is Melody Gallagher. I'm a teacher at Wilbur-Cross High School and a resident here in New Haven. I wanted to thank the Board of Education, Dr. Tracy, and Mayor Elliker for not only enforcing the mask mandate in schools, but maintaining it in these more recent months. As an immune-compromised teacher, the mask mandate has allowed me to continue to teach while also remaining safe. With the upcoming April vacation, the slight uptick in COVID cases in New Haven County, and the anticipated rise in cases this spring, I'm hoping that we will continue the mask mandate for schools moving forward. It was reported as breaking news just today that with COVID cases low but rising sharply, Philadelphia will reinstate its indoor mask mandate next week. It is the first major US city to do so. Additionally, today's news reported that at least 5 major universities have reinstated their mask mandate as well. I'll be the first to tell you that I'm sick of wearing a mask. I'm also sick of being immune compromised, but that's not going to change. Despite being annoyed at wearing a mask, I have to say it's been actually pretty nice not having gotten sick these past 2 years. I'm pretty sure my students are tired of wearing masks too. However, they all know my health status. I've been upfront and clear with them. And I have to say, my students are extremely respectful. And yes, some need a few reminders, but they all wear their mask properly while in my classroom. We've all been able to socialize, get to know each other, develop healthy friendships, and learn the curriculum all while wearing masks. I was eligible for my fourth shot months ago, and I got it as my status puts me in the very select high-risk category. I anticipate that I will have to continue to receive boosters at a shorter interval than others. And with that said, I'm hoping that my health status won't prevent me from being able to do what I do best and what I love, which is teach. This isn't just about myself, though. There are other students who are unvaccinated for a variety of reasons, immune compromised like myself, or living with immune compromised people. There are also other staff members that fall into similar categories, and although we all have the right to choose what health precautions we want to take, I'm hoping the board, the mayor, and the superintendent recognize that public health is about protecting the most vulnerable. So again, I'm just asking and hoping that you continue the mask mandate moving forward. Thank you for your time and for your diligence around instating COVID protocols. Thank you.
Vaccine.
Our next speaker is Donna Levine.
Good evening. My name is Donna Levine, and I live at 23 LeGrand Road in North Haven. I'm a property owner in New Haven. My daughter and son-in-law are both teachers in New Haven schools. My husband and 3 children attended New Haven schools, and I have 2 granddaughters who currently attend school in New Haven. So as you can imagine, there are a lot of subjects I could talk about tonight. But I'm a lawyer, so I want to talk to you about the law, specifically the newly passed Right to Read legislation, which can be found in the Connecticut General Statutes at Public Act number 21-2, sections 394 to 404. This legislation was approved by the Connecticut legislature as part of their 790-page budget implementer bill in June 2021. The law mandates the establishment of the Center for Literacy Research and Reading Success in Connecticut, which will oversee each district's reading programs for grades pre-kindergarten to grade 3 inclusive. I've copied the relevant sections of the law and would be happy to email copies to any member of the Board of Ed, administration, teachers, or parents who request it. My email address is sdsij@aol.com. The law mandates a systematic statewide reading response based on the science of reading. The law defines, quote, scientifically based reading, research, and instruction, unquote, as, quote, a comprehensive program or collection of instructional practices that is based on reliable, valid evidence showing that when such programs or practices are used, students can be expected to achieve satisfactory reading progress, unquote. The law details at great length the curriculum requirements, professional development, and teacher preparation programs to be implemented over the next few years. All districts in Connecticut will be required to implement early literacy reading curricula that are evidence-based, not anecdotal. The Commissioner of Education will implement a variety of steps required by the legislation with a full evaluation of its success in February 2024. New Haven needs to pay attention. Instead of fighting to keep the current failing system intact, we need our administrators to get ahead of the law and do what is necessary now. In short, we need to move away from the failing balanced literacy method of teaching reading to an evidence-based model of structured literacy. So I'm here to say the state legislators know there's a reading problem. The members of the New Haven Board of Education know there's a reading problem. The members of the New Haven Aldermanic Education Committee know there's a reading problem. Why don't our administrators pay attention and not just recite anecdotes about those who have successfully navigated the New Haven school system? We need to talk about those 70% or so of our students who are not successful in adequately learning to read in the New Haven schools. Let's do right by them. Thank you.
Our next speaker is Sarah Levine.
Hi, I'm Sarah Levine, and yes, that was my mom that just spoke. It's all in the family. Here we have a passion for New Haven and helping make our schools better. I'm a TESOL certified reading specialist at Barnard School, and I'm here to speak again about the reading crisis. I've spoken at the last couple of board meetings, and I would like to remind everyone that the reading crisis is ongoing and that it needs to be addressed quickly and in a purposeful manner. I recently re-listened to a podcast by Emily Hanford called Hard Words, Why Aren't Kids Being Taught to Read? In reference to the 60% of kids nationally that are not being taught to read proficiently, one of the educators in the podcast said, it's become easy to say, well, that's just the way it is. I fear that too many in New Haven have gotten to the point where they are also thinking this. Otherwise, I would expect that we would be dealing with this reading crisis as if it were the emergency that it is. Here's the thing, it doesn't have to be this way. I know talking about structured literacy and the science of reading can bring up strong emotions in people. And so for a moment, let's consider just the problem. About 70% of New Haven's K-5 students are not reading on grade level. Even if you don't agree with structured literacy, I think we can all agree that having only 30% of our students reading on grade level isn't good enough. It begs the question, what are we going to do about this? Because we can't do nothing. If you don't believe that structured literacy is the answer, what do you believe will make our students readers? What is your evidence, and how do you plan to implement this? The answer to this question cannot rely on intervention fixing the problem. This is a tier 1 issue that needs to be dealt with at the tier 1 level. Last week, I went to a webinar where people from the Hartford Public Schools spoke. They presented their plan for how they're going to conquer the literacy crisis that they are also facing. The first step in their plan, which they are currently implementing, is to train all K-3 teachers in how people learn to read. They are training people using LETTERS, which stands for Language Essentials for Teachers of Reading and Spelling. I would like to see a similar plan in New Haven, because the answer to what we are doing can't just be that we are doing the same thing, but we're doing it harder. And as far as I can tell, that's the current plan. Thank you, and I look forward to hearing from someone regarding this issue. I also welcome any of the Board of Ed members to come and visit my classroom and my school to see some of the work that we are doing in service of students. Thank you.
Our next speaker is Kirsten. Please state your full name when you come on.
Hello. Can you hear me?
Yes, we can.
Hi, this is Kirsten Hopes McFadden. I am a teacher at ESUMS, and I'm here to talk about the mask mandate. I encourage the board, after listening to Ms. Bond's report, to continue with the mask mandate for the city of New Haven. And the reason I'm asking for that is that the numbers are steadily rising. New Haven is still in the red. And while I know many people would love to take the masks off, it is working. We are keeping people from getting as sick as they possibly could get sick if the mask were to be removed. I don't want us to move forward because everybody else is doing this. We have been leaders in this from the very beginning on keeping our community safe. And I ask that we continue to be leaders. Let's not stop being followers at this time. Some of the buildings, including my own, you cannot open the windows. So therefore, we can't open the windows. So even though the ventilation system has improved, the great thing about opening the windows, we cannot do. We have many immunocompromised people in this district. We have many students who have not been vaccinated. And although wearing a mask may be inconvenient, is not as inconvenient as being sick or dying. Finally, many teachers did have to take days off during the last surge, and as of April, they still haven't received their days back. So you have many teachers still working with no sick days, waiting to get those days back. And then if they have to use days now, their pay is being decreased while waiting for those days. And one way that we can negate that problem is not causing people to be put in a situation where they're getting COVID again. Let's just have to use, if we're using our days for other sicknesses or illnesses, that's one thing. But if we have to use them for sickness, for COVID, in addition to other illnesses, and it's taken this long since January to get our days back, you're really putting people in a financial burden. So I'm just asking that after you hear the report, which I hope is suggesting that we continue with the mask mandate, that we vote to keep it on. We just have 2 more months to get through this school year. We can revisit it for the next school year, but let's just do it and let's keep us safe. I mean, I was really nervous going back to work in January. I am back there now, and my students listen to me. Every now and then the mask may fall below the nose, but if I ask them to put that mask back over their nose, they listen. My school is really good about If children don't listen, they will have them removed from the classroom and have to give them a nice talking to. So it really is working. I have not had to use that rule because, as I said, my students listen to me. And I just ask that you continue with the mask mandate. Thank you.
Our next speaker is Tony. Please state your full name.
Hi, good afternoon, everyone. This is Tony Criscuolo. I am a teacher at ESUMS in the history department. I had actually two things that I wanted to mention. The first thing, I wanted to echo what the Levine family was saying with regard to reading, but I think we have missed the bus on something very, very important. Did you know that during our Great Depression, not one public library closed, which was an amazing accomplishment? Now we are building schools with no library. Ask any student and they will tell you that they do not like to read books online. They do not like ebooks. They like physical books that they can hold in their hands. We will never be able to inspire a love of reading amongst our students if we don't have a library and great librarians. It is such an investment. And it's a great investment that pays off. The love of reading will inspire the poorest reader to want to read. And that's what we want in the end. So I encourage support for our libraries and stop building schools with no libraries in them in the future. The other thing that I wanted to mention is building maintenance. And I must mention again, over at ESUMS, we were the ones that had a drunk driver hit a door and it took a year to replace the door. Would you leave your house without a door on it for a year while it was being fixed? Our mechanical doors that open automatically where the students come in have not been working well within months of when we moved in there 5 years ago. I got caught in one a couple of weeks ago and I can provide a picture. It crushed my lunchbox and pushed me through. If it had been my arm or my hand or one of the many students who passed through, that arm would have been broken. And those children or myself would have been very badly hurt. I understand that somebody from somewhere in the city came, but as per usual, I presume they're whittling the door as we speak. And it's going to take years to replace something that broke within months when we went there. As a Board of Education, when you hire people, when you give contracts to people to do work, if they do not do what they're supposed to do, you must get rid of them, but you must hold their feet to the fire to do what they have been contracted to do and what they have been paid very well to do. I wish I was in charge of facilities management, and I wish that I could get an order done. The door that took a year to come to us that was hit by the drunk driver came from East Haven. It didn't come from California. There's something that's going on with the management of the facilities. Our buildings are so beautiful and so costly. Please maintain them and get contractors that will do that work on behalf of the people of New Haven and the students of New Haven. Thank you very much for your time and thank you for the work that you do.
Madam President, that concludes the hands that are raised.
Okay, thank you, Dr. White and Dr. Joyner. Moving on to the action items, the first being the approval of the board meeting minutes for March 28th. The motion to approve.
So moved.
Thank you, Dr. Joyner. Is there a second? Mr. Wilcox?
To accept the minutes,
Thank you.
March 28th.
Thank you, Dr. Joyner, Mr. Wilcox. Any discussion? Okay, seeing none, we'll vote to approve the minutes for March 28th. Mr. Wilcox,
Yes.
Dr. Joyner, Dr. Joyner, Dr. Joyner, can you hear me?
Are you surveying people now for yeah, nay?
Yes.
Okay, I can't hear you as well. Yes.
Okay, thank you. Dr. Yarborough,
Yes.
Dr. Benitez,
Yes.
And are the students on, Dr. White?
I don't see any of them.
I don't see them on there. Okay. Mayor Eliger,
Yes.
Mr. Goldson,
Yes.
and I am a yes as well, and so the minutes pass for March 28th meeting. Next is the personnel report, Dr. Tracy.
Thank you, Madam President. Good evening, board members of the public who are observing these meetings. Thank you. And I hope today has been a good day for everybody. It was a good day for me, although there were a lot of meetings, but here we are. On my personal report in the action items, I have two appointments and one transfer. In terms of administrators, and yes, that's where we are. I ask that the board accept my personal report.
There a motion to approve?
Madam Chair, I have to recuse myself from a vote on one of the persons on that list.
Okay, thank you, Dr. Jordan. Mr. Wilcox?
Yeah, I'd like to make a motion.
Go ahead.
And that is that we approve the promotional appointment of Monica Joyner.
I'll
Is there a
second.
second? Thank you. Any discussion? Mr. Goldson?
Thank you, Madam President. I'm going to vote against this appointment, not because this candidate may or may not be qualified or highly qualified for this position, but I have a fundamental problem with in opposition to administrative positions being promoted with members, with family members sitting on the board. So I will be voting against this appointment for that reason only. I am not making any kind of claim that there's any sort of impropriety here, but you know, our ethics also state that if there is an ability for people to possibly see ethical issues there, that's a problem. So I will be voting against this appointment. Thank you, Madam President.
Thank you, Mr. Goldson. Mr. Wilcox?
I believe Mayor Elker had his hand up first.
Mayor Eliger, where are you? There you are. Go ahead, Mayor Eliger, and then Mr. Wilcox.
Yeah, I appreciate Mr. Goldson's opinion. Two things about this. First of all, there's, as I recall, precedent that Mr. Conway's family member was approved as administrator in the past, but we can't limit a family member's opportunities just because there is a member on the board. What's appropriate is the member on the board recuses themselves from the vote that impacts the family member. But the idea that New Haven's a small place, and there's people that work within the Board of Education that have family members that that are on the Board of Education, a lot of other positions, and to limit that family member, that individual's opportunity for a new job is not at all, I don't think, fair to that individual. And it's also not in conflict with the ethics of the situation, particularly if that board member recuses themselves.
Thank you, Mayor Eliger. Mr. Wilcox, and then Mr. Goldson, and then Dr. Benitez.
So I did a lot of looking into this over the weekend because I also believe that we need to really examine closely these situations where we do have somebody being appointed to a position who has a family member on the board. I think we need to give it extra scrutiny. And I hope we all did. Taking a look at the resume that was provided, I see a person with 20 solid years of experience as a math teacher, and then administrative appointments at various levels that also included oversight of math instruction in the schools. And so I did, weighing that out, and then also seeing the references provided included
current curriculum supervisors, including Mr. Matthews, who is moving on at the end of this year. So that's why I'm going to be supporting this. But along those lines, it would probably be very good for us, Dr. Tracy, if I may ask, if you could describe the hiring process in this case so that we have a good sense of how the district handles cases like this.
So with all our hires, whether it's supervisors or principals or assistant principals, there are processes in place where people carry out first a resume cut, of the different applicants that come into the pool. Then they interview those people with teams of individuals. In relation to these cases with Ms. Joyner, there are about 3 different sets of interview, 3 different times, 3 different groups of individual, and then the 4th group, my assistant superintendents, before anything comes up to me. So I actually had nothing to do with the process. They sent the recommendation up to me. From there, I meet with the candidate, with the finalist, and talk to the candidate, and we move from there. So that's the process that we have followed. Same thing with the principal.
Okay, thank you very much. So as I said, I did review all this. I did look at the anti-nepotism policy that we do have in place in Series 4000. It does not say that this cannot happen. It just says we need to disclose the nature of the relationship. So this individual has a family member who is a board member, and I do think we need to take a look at that. I looked at the contract with the administrators union to double check the salary information, and everything to my eyes looked like it was completely in order based on our contractual arrangements with the administrators union. So, but we definitely have to give extra scrutiny to things like this to avoid the appearance or the actuality of favoritism and things like that. But I think as I mentioned before, the 20 years experience as a math teacher and the 10 years administration experience for this New Haven high school graduate is the reason why I'm going to be supporting this. Thank you.
Thank you, Mr. Wilcox. Mr. Goldson and then Dr. Benitez.
Thank you, Madam President. Again, this is not about any particular individual. For me, this is about process. Yes, we do have one candidate's resume in front of us, but we don't have any other candidate's resume in front of us. So we can't compare that candidate to any other candidates to see who might not have risen to the top based on a similar or even better resume. We don't know if that occurred because we haven't been a part of that process. So to suggest because we have a good resume in front of us doesn't justify the process, because we haven't seen the process. We heard about it, but we haven't seen it. In terms of Mr. Conaway's relative appointment, I would have had, if I had voted that day, and I did not, I would have voiced the same opposition, and that is that I don't think that I think there's enough people in this city that could serve on this board that we don't need board members who have relatives who are moving through the upper echelons of the system. I think it's just a perception problem for me. I don't have any relatives, direct relatives working in this system, except for one niece who is a paraprofessional, who's an assistant teacher. If quite frankly, honestly, if I had a relative who was going for or trying to become an administrator, I would certainly take myself out of the process completely, because I wouldn't want that person's appointment tainted by the possibility that people may perceive that there was an inside move on this. That's just me. That's just the way I roll. In the end, this is not about any particular candidate. It's about the process and about our perception as a board out there in the community. Because God knows, before I even knew this on the blue sheet, I must have got 10 calls and emails about this from people in the community that said, this is an inside play, this is unfair, this is and that. It may or may not be true, I don't know. But what I do know, there's a perception out there. And I would not want to be, if I were that staff person or that board member, I would not want that perception out there to taint what probably is a very good choice for this position. I don't know that for sure, because again, none of us were involved in the process. We don't know what other candidates are out there. We don't know what the other resumes look like. Again, I don't want anybody to take this as a shot or a slap against any particular candidate or any particular board member. I would have the same comments for any other administrator appointment when they had a close family member on the board. Thank you, Madam President.
Thank you, Mr. Goldson. Dr. Benitez?
Yes, I mean, I agree with Matt that we have to do a little bit more homework with when a relative of ours is somewhat involved in something like this. But I want to warn us all to make sure that we understand that a lot of our family members, I mean, I only have one child who's a part-timer, like Mr. Goldson was saying, doesn't have a big to do in the district, but formerly she was a full-time person who worked in offices and was a clerk, and she could have risen to the top, and I would have been, you know, during this time, but she has chosen not to. So I want us to be careful about that, because I believe our children have stuck to New Haven. And of course, I agree with Mr. Goldson. We don't know the other resumes. I wish we had seen the other resumes and maybe comments, or maybe this should have been discussed privately before we air this conversation publicly. But publicly, what I have to say.
Oh, no. Is it me or is she frozen, or did I freeze?
She's frozen.
Okay. Let me text her because I want to give her the opportunity to finish her thought, if we can get it back quickly.
Motion detected at the driveway.
Any other discussion? She just texted if we can hear her. Any other discussion on this matter? Go ahead, Mr. Goldson.
Madam President, would it be appropriate for us to hold off on voting on any issues until she's able to return? Could we go to some non-voting items and then come back to the voting items once she returns and able to fully participate?
I don't see an issue with it. Attorney Alexiadis, do you?
She's just joined.
Can you hear me now?
Oh,
I'm sorry.
there she is. There you are.
Sorry, my Wi-Fi went dead. I don't know what's going on. Okay.
Go ahead.
Sorry,
You can
I was
finish your
just
thought.
saying, I'm just warning all of us about this, because many of our children have stuck to New Haven. They have stayed in this city. They have serviced our children, whether they are teachers and rise to become administrators. Again, I was gonna abstain from this candidate because I personally worked with her when she was a teacher and I was an administrator. But then my thinking was, I have to trust. We constantly are talking about how we need to trust the superintendent and her team in making a final decision. Of course, if we have concerns, we could have discussed it with her. But my concern is beyond that. I know there's always great candidates in New Haven. We train our people well, but we also have to trust that the process works. If we don't trust this process, then those who can should then have a conversation with the administrator, whether it's teachers or whoever, and talk about how the process needs to be changed. But at this point, we cannot change the process. The process is what it is, and we were not involved. In the past, we've had board members in some of these processes when it is something like a high school or a position that has been mentioned as a concern, but we did not get involved in that. And I believe at this point, we need to trust the decision that is in front of us. That's all I have to say, sir.
Thank you, Dr. Benitez. Any further discussion? Okay, seeing none, we'll go to approve Monica Joyner as supervisor of mathematics. Dr. Joyner.
Recused.
Dr. Yarborough.
Yes.
Students are still not here. Mr. Goldson.
I'd like to abstain if I can.
Okay. Mr. Wilcox.
Yes.
Dr. Benitez.
Yes.
Mayor Elicker.
Yes.
And I am a yes as well. And so congratulations to Ms. Joyner. And so is there a motion to approve the rest of Mr. Wilcox?
Yes, I'd like to move that we approve the remaining action items on the personnel report.
Second.
Thank you, Dr. Joyner. Any discussion? Okay, seeing none. Dr. Joyner?
Yes.
Dr. Benitez?
Yes.
Mr. Goldson?
Yes.
Dr. Yarborough?
Yes.
Mr. Wilcox?
Yes.
Mayor Elicker?
Yes.
And I am a yes as well. So rest of the remaining personnel report passes. Dr. Tracy, did you want to
So
say a few words?
thank you, Madam President. Thank you, Board. I need to say something. Miss Monica Joyner, everyone knows, a proud product of New Haven Public Schools. She went to get her education. She came right back, stayed in New Haven, and did what she had to do to support the students of New Haven. And she has spent a lot of time holding administrative position, Wilbur Cross High School, Hill House, Troop, County West Hills, and most recently at Career High School. And she has given 30 years of her life to public education here in New Haven, well-deserving, a longtime math teacher, having the background and information to help move our system forward. So I'm proud right now to present to you as Ms. Monica Joyner. I hope you're on, just say a few words. There you go.
Yes, ma'am. Greetings to everyone on the board, Dr. Tracy, Mayor Elicker. I'm extremely proud, humbled, and excited to accept this position. Dr. Tracy, I'm deeply honored by your confidence in my ability to lead our district's math department. I'm excited about the opportunities and challenges that lie ahead to help our students reach the enormous potential that lives inside of them. I would like to thank Mr. Ken Matthews for your dedication to our district for the past 18 years. Thank you for the foundation you are leaving for me to build upon to positively impact the mathematics learning of our children. I want to thank all of my former students from whom I learned so many lessons about teaching, about learning, about adjusting plans to meet your varied needs, and about letting go of the reins to allow you to fully embrace your power as learners. I want to thank my family and friends for your unwavering support and belief in me. I would not be who I am without you.
I am eagerly looking forward to working with all of the outstanding educators in the math department, the administrators in our schools, and with all the other curriculum supervisors to strengthen learning experiences for all of our students. We will have our ups and downs, our good times and bad, but we will get through them all by putting the interests of our children first. The students of New Haven Public Schools deserve no less. Thank you.
Thank you, Ms. Joyner. Thank you so much.
Thank you.
Now we turn our attention to Ms. Kanisha Slowly. Ms. Kanisha Slowly is taking on the responsibility. She's going to step into some big feet there from Ms. Diane Spence, who is retiring from County West Hills. It's a 600, sometimes 700 members school. Ms. Slowly holds certification also as superintendent. She has dedicated her career to education for 20 years, a general education teacher, science teacher, instructional team leader, lead Connecticut resident principal, as well as consultant of leadership development for aspiring leaders and teachers. She comes to us highly recommended. She was vetted through similar processes as Ms. Joyner, several different sets of interviews, and then was recommended up to my level for conversation. I welcome Ms. Slowly to New Haven Public Schools. Ms. Slowly, you're muted. You're muted, Ms. Slowly. All right.
Board of Education members, Superintendent Dr. Tracy, members of the executive administrative team, County West Hills learning community, and members of the public. I want to express my sincere gratitude to you for my appointment as principal. I am committed to sustaining a school community of excellence that continues to promote and support students, teachers, staff, and the community at large. I am honored and I'm extremely excited to continue the legacy and excellence of County. Thank you.
Thank you. Welcome, Ms. Slowly. Thank you. The next candidate is not new to us, Ms. Tessa Johnson. Currently serves as our supervisor of professional learning, 24 years of service in public education. And she began her career as a fourth grade teacher in New York, Harlem, New York, technology coordinator, administrative instruction leader, Title IX coordinator, designate and assistant principal. And she believes in supporting all stakeholders through transformative professional engagement. Her pedagogical trajectory has been guided by the principle that everyone must be heard, respected, and valued, even when perspectives differ. Ms. Tessa Johnson is going to take on the leadership of King Robinson Interdistrict IB Magnet School. Ms. Tessa, you're muted.
Praise be to God. Madam President, members of the board, Superintendent Dr. Tracy, assistant superintendents, members of the New Haven Public School listening community, good evening. Thank you kindly for this opportunity to be of service to others. I accept this responsibility in honor of all the people that have poured into me, becoming more of who I am today. I am a woven tapestry of my mama, my granny, Miss Wilma, Desi, auntie and uncle, Gina, all of the mentors that I have had on this journey, my husband also, just to name a few. I am a child of immigrants, a Black West Indian from the island nation of St. Kitts and Nevis, a homeless teenager, an advocate for students' potential, and a lifelong learner. I share this with you not because I so want to, but for one reason only, that it takes a village to raise a child into a man or a woman. I speak with a measure of distinct pride for who I am and of whose I am. I am committed to being an advocate for our students, embracing who they are and giving them every opportunity to become who they are meant to be. I look forward to building relationships with families and all stakeholders of King Robinson community as we move forward in building upon what makes King Robinson a great place to learn and work. I am humbled and honored to be entrusted with the principalship of King Robinson. Thank you ever so kindly.
Thank you. And there ends that presentation, Madam President, of my personal report. Thank you so much, everyone.
Thank you, Dr. Tracy, and thank you all, ladies. Congratulations to you all.
Thank you.
Okay, and with that, we'll move on to Ms. Maritza Bond, the City of New Haven mask wearing update. Director Bond.
Hi, good evening, everyone. Thank you for the invitation to be able to provide an update. Today, I will be sharing just some few slides if I would have sharing ability. Here it is. Can everyone see the slides? All right, so good evening, everyone. It's such a pleasure. I was very moved. Was moved by the testimonies this evening that were shared by many people that are in support of the mask mandate to remain in school and to continue to protect our staff and children in this at this juncture. I aim to share just a brief situational awareness of where we are currently. I will talk a little bit about the variants of concern, restate some of the school issued guidance that I presented previously, talk about some newly released data that we have on hand and the recommendations for us as we continue to move forward. Let's see. So, sorry, I'm seeing a comment on my screen. So for our COVID-19 in our community, what we see in front of you is, as you know, CDC updated their county levels and how they do metrics. They look at hospitalization as well as the inpatient, basically ICU beds that are available. And they also look at the COVID positive rate as a county. And right now we are in the low rate. However, when we look at the metrics that the Department of Public Health issues at a 7-day case rate, this is again just PCR test that you see in front of you. What we want to just emphasize is that the rapid antigen tests that are taken are no longer reported to the Department of Public Health, and rapid tests that are taken at home are also not taken into account with the data that I present with you this evening. Right now, we're seeing about 31 cases per 100,000. So we're seeing an increase. Our test positivity rate in the city of New Haven, it's about 3%. And we also saw an increase in hospitalization within the past week. And so we're continuously monitoring that closely and also watching the variant of concern. At this juncture, what we're seeing is that the variant of concern, as it was occurring in Europe and happening in Europe, is BA2, aka Omicron's cousin. We are surveilling that. That is about representing 80% of the cases in Southern Connecticut. And so we know now that there is a new variant before us. As you know, Omicron BA1 was the prior surge that we had in January. And so right now we're closely monitoring a possible resurgence. When we look at the COVID national on the district cases, we are still closely monitoring that. And so what you see in front of you is the COVID cases for the district. About 1 to 12 students have tested positive within the district, and the breakdown of the different levels of percentages is also on the right, illustrated by the different age groups. And so we continue to monitor that closely and work in partnership with the district to ensure that we are having them reported and also tracked. We are also monitoring our vaccination rates, which are really vitally important to ensure that we're protecting our staff, and also our children are being protected for the different age groups. And so what you see in front of you is the current percentages for ages 5 to 11, which is first dose 34%, second dose 27.5%. And when you look at the age group for 12 to 17, the adolescents are higher at 65%, second dose at 56.9%. And so overall, as a district, you see 49% as first dose and 42% for a second dose. When we look at the vaccination rates by different surrounding towns, what you see in front of you is the different percentages. As you can see, we are lagging in some areas, but we are seeing a concern district-wide within the county. And so we wanted to point out the vaccination rates also by town, as many children also are part of these different communities. One of the things that we also look at from our daily monitoring is our acuity levels among our district. And so what you see in front of you, and I presented this in the past, is sort of the medical conditions that we see within our district, the number of cases that we see affected for a specific medical condition, and the percentages. So as you can see, medical conditions around asthma in the district are around 31%, diabetes type 1 and 2, 0.7%. Other cases such as cancer, cystic fibrosis, or heart or obesity is about 0.9%. And then life-threatening food allergies is about 8%. And so in total, we see about 4,890 children in our district, averaging 40% of high-risk students. And so this is what we continuously assess throughout the district to ensure we are providing support, but most importantly, when we're looking through making decisions about mask recommendations, looking at the level of high-risk students that we have throughout the district. We also want to point out the race and ethnicity background within our district. As you know, during the pandemic, disproportionately Black and Brown communities and communities of color in general were negatively impacted by COVID, and 60% of our district is representative of that. And so we have to take into account that when we looked at hospitalizations and deaths overall throughout this pandemic in our city and within our state, Black and Brown communities of color were negatively impacted at a higher rate. When we look at the community risk levels, we also wanted to take into consideration the community levels. Right now, while the county is, the CDC recommendation is at low, as I indicated earlier, it does look at the range of 3 metrics, which is hospitalizations, the ICU bed availability, and the overall county positivity rate. And again, the metric of the positivity rate has changed now that they're no longer taken into account. The rapid test kits are not taken into account, as well as looking at the rapid antigen testing as a whole. As a statewide, we are in the yellow category. When we look at the yellow category, we definitely urge the community to get recommendations about wearing masks in the public. Right now, as you know, in the district, we are still with the mask mandate. But if you're in social settings or different social gatherings, really taking heed to recommendations from your provider and ensuring that you are protecting yourselves. One of the things that we also reviewed, our last board meeting that I attended, was the DPH issued guidance. And so I'll review that quickly, but I do just want to emphasize that I did present this previously, but it's important to point out that we still want to ensure that COVID-19 vaccination for all eligible students and staff, including boosters, are being promoted and are being emphasized to participate. We are still offering vaccination clinics 7 days a week. So please be our messengers and help us push out the messages to our parents and to our staff and to our children that are age eligible so the parents can get their children vaccinated. Isolation guidelines is a main method of preventing outbreaks. So making sure that individuals that have symptoms or have tested positive for COVID are isolating themselves from also other family members in the home. And then quarantine guidance for student and staff who have been notified who are high risk close contact exposures and those in crowded social gatherings. are still in place. Recommending prevention strategies, including testing and self-testing, is something that we continue to do as a district. I want to commend the public school administrators for continuing prevention strategies, as well as being proactive and offering rapid test kits so that during the spring break and upon return, we can offer that service. So very grateful for that proactive approach. We wanted to continue to advise parents to report positive cases to the respective schools so that we can be able to ensure that we control and mitigate any potential outbreaks in the future. We want to be able to be prepared to respond quickly to any increases in cases or clusters. And so we will continue open communication, but we want to make sure that we are reporting them and also trying to ensure that if you have an excused absence, that is being recorded if you test positive. Universal masking policy for students is part of the recommendations, especially when we're looking at lower vaccination rates and looking at the number of factors that I just shared. We want to still promote and foster cohorting during meals and recess and any other large gatherings to limit any potential spread. And also limiting outside visitors is still recommended as part of the guidance. Notifying potential exposed students and staff and recommending testing is part of the guidance, as I just mentioned, and also being part of the Project COVID Detect Connecticut is a proactive approach that we're still recommending to be part of within the district. And again, the self-test kits is another avenue that we are offering as a way to be proactive and being able to identify any potential positive cases. We want to ensure that we still stay vigilant with our mitigation strategies so that we can reduce transmission of COVID. So spacing, ventilation, cleaning, and of course, open communication between parents and caregivers, as well as school administrators to ensure that we are keeping open communication and still protecting both our staff and our children so we can keep our schools open and have our students have a positive learning experience. Some of the considerations of the newly released data that I would like to share at this time. One of the things that we have done throughout this pandemic is to ensure that we combat any misinformation and continue to report data that is supported by science. It still remains the central focus for us in the city of New Haven. And so I want to share that what's really critical and important to share that in the midst of Delta surge, if you all remember that variant, that the National Institute Health showed a study that 72 fewer cases of in-school transmission was demonstrated when we had mask mandates versus those schools that had optional or partial masking policies. We also want to highlight that mask optional policies led to outbreaks in Concord, Massachusetts, where mask was on the mask optional policy. There were 44 reported COVID cases in a particular grade and additional absences in that particular middle school, and then also led to school closure. We had one school outbreak in Greenwich, Connecticut, where there was reported 40 cases across 11 schools in 2 weeks, within 2 weeks after mask optional policy. And so these are two prime examples of when policies change and the impact that it can have in our schools. One newly CDC MMWR that was just issued demonstrated that universal mask requirements had a 23% lower incidence of COVID-19. And as you see in the illustration in the figure to your right, really when masks are implemented, the lower the cases, and when it's not, you see an increase in COVID cases. So we know that masks remain an important part of this multi-component approach to preventing COVID-19 within K through 12 settings. Pediatric hospitalization, we saw increase during the surge throughout the United States. And so despite the fact that that was a myth, we did see an increase in pediatric hospitalizations throughout the United States. And we want to make sure that we continue to have mitigation strategies in place that are going to be effective in protecting our children. And we saw that happen particularly among Black and Latino communities. When we say that COVID-19 is not as serious as the flu, that is also a myth. Through this pandemic, we have seen over 1,200 children die from COVID-19 in the United States. And over the same time period, fewer than 10 flu-related childhood deaths have been reported. Before the pandemic, fewer than 200 children had died of flu each year. And so it's important to note that when they say that COVID-19 is not as serious, we see it, the data has proven that, and we want to be able to be vigilant in protecting our children. Long COVID has impacted many adults and is impacting our children with a number of side effects that continue. And so we want to also make sure that we do not disrupt our children's learning or even our ability for staff to be able to be back in schools, being able to provide support to the district. And we know that several studies have now shown that long COVID has an impact on both adults and children. It is important for us to continue to prevent long COVID by reducing infection. And it's important for us to ensure that we are promoting vaccinations and continuing to wear masks. We also saw the multi-inflammatory syndrome among children, also impacting our children, a total of over 6,800 across the United States. So that continues to impact children. We've been fortunate in Connecticut, but we know that that is happening even in our state. And so we want to point out the impact that it has had across the United States and want to make sure that we continue to, again, emphasize the importance that although it's rare, it is a serious condition that appears among school-age children, and it has detrimental effects on the children and impact. No evidence that has demonstrated that it affects the learning of children, despite that being a myth in some communities. There are no claims around that. I want to emphasize that the school administrators have done a phenomenal job to accommodate any special requests for any children that have special needs. However, we know that mask serves as a protector, not a deterrent from being able to learn in schools. And so we continue to monitor the evidence that supports this and want to share that there is no evidence that there is any learning loss by wearing masks. So our recommendations as of today is that we want to make sure that if you have any symptoms, please get tested. PCR continues to be the gold standard test. However, rapid testing at home is available. We want to make sure that you get the proper treatment. If you are experiencing severe symptoms and need to see your medical provider. And most importantly, we want to ask you to please get vaccinated. Let's continue to protect ourselves and protect others that are high risk of contracting COVID and can lead to fatalities. I also want to encourage mask wearing. We know that that is one avenue that works and continues to protect us as a community at large. We also want to continue to encourage our parents and our district to participate in the project COVID Detect CT so that we can be able to proactively have free weekly COVID screenings for children. And that is also available, which Dr. White can elaborate on. And I want to continue to promote our vaccination clinics. If you would like to have vaccination flyers submitted directly to you, let us know. We will get them to you. And we also want to recommend that at this juncture, based on the recommendations that I just outlined, we are asking that we maintain our mask mandates and we will reassess after the April spring break so that we can then see where we are as far as our hospitalizations and positive cases. And we continue to monitor our sewage surveillance data because that is an indicator that helps us to at least be able to know where our city is. And we will continue to update the public should a resurgence be impacting our community within the next few weeks. And with that, I want to thank you for your time and your attention.
Thank you, Director Bond, for that presentation. Are there any questions for Director Bond? Mr. Bolton?
Thank you, Madam President. I want to thank Director Bond for this presentation. That was very helpful. It was chock full of information. I have to say I'm a little disappointed that we didn't receive it in advance because going through it that quickly raised a lot of questions for me that, unfortunately, went through it so fast. I'm having what we call chemo brain right now, and I just really couldn't keep up. And I would have appreciated being able to work over the weekend and looking at the presentation and maybe even sending my questions in advance, so that we could have a intelligent and fair conversation about this presentation. For instance, there was two examples of school districts or two examples about outbreaks, one national, one in a local school district that had mask optional, but we didn't give any examples of school districts that went mask optional that may not have had outbreaks. And I would have liked to have been able to ask that question and get that question answered. One of the teachers said at the beginning during the public testimony that we only have 2 months left. Why not keep masks? I sort of agree with that. I mean, it kind of makes sense. We're pretty much through the year. Doesn't cause much harm for us to just finish out the year. And I would have loved to have just heard that from the administration. I would have loved to have heard, okay, look, we've decided, we got 2 months left. We're not even going to consider going maskless or optional. And that's in the discussion, and we could talk about what's going to happen next year, but we haven't even gotten that there. As I said, as I commented as a result of the last presentation, we are not getting guidance on what metrics will be used to move us into that, into another category of being optional or maskless total. And we don't see that in this presentation also. I mean, we saw some metrics that said this is one of the reasons why, these are some of the reasons why we want to stay masked. But some of those metrics are not going to change. For instance, high risk students, that 40% was 40% last year, is probably going to be 40% next year. I mean, it's the same students that are in the system that are moving along, and that number is probably not going to change. So is that the metric that we're using to keep us masked? And if that's so, then we're never going to go maskless, I guess, if that's the metric that we're using to determine whether we stay or get rid of the masks. Again, though this was a great presentation, I appreciate it. I hope that we can get a copy of it. I hope that in the future we get them in advance, and that it is also posted on our website like all of our other board materials, so that people could see it and they can understand it, and they can understand why we're doing what we're doing. Again, I guess I'll ask the question. I don't know if it could be answered today, but are we going to stay masked for the rest of the year? And I have no opposition to that. I am not an anti-mask person, like I said, because of my condition. I'm constantly wearing a mask. I had a birthday party yesterday where I wore a mask the entire birthday party. I understand the need for masks. I just want to be able to give the public who we serve an ideal of where we are going and how we get there, where we are, where we're going, and how we get to where we're going, whether it's continuing to be masked or go optional or whatever. Thank you, Madam President.
Thank you, Mr. Bolton. Dr. Joyner and then Mayor Elliker.
Madam President, I have a different take on the presentation. First of all, I think that Marissa Bond has been exemplary and is likely one of the best municipal health department administrators just about anywhere. I also think that it's really important for us to try to stay ahead of some of this stuff by doing take an initiative to do our own reading, but I also think that we should make sure we're reading the right websites. There's a great app called ReadWise, and they evaluate websites, and clearly there's so much misinformation out there about COVID. But the board's record has been thus far to follow the science, and also the mayor's initiatives have followed the science. And it's very clear, I believe to anybody, that we can't take off masks. The problem with all of this is that instead of it being a scientific decision, in many places it's a political decision. And when you make scientific decisions politically, you always get into trouble. And so I would encourage all of us to read widely as possible. The University of San Francisco's medical school is probably the best infectious disease, one of the best infectious disease resources that we have because of what they did with AIDS and the acclaim of their physicians. There's great articles in Atlantic magazine, and it's highly reputable magazine. And I'd also like to wish Mr. Darnell Golson a happy birthday, belated happy birthday. Good job, Maritza.
It's actually related. Today is my birthday, actually.
Thank you.
Well,
And
happy birthday to you
Darnell.
today.
Happy
Birthday, Darnell.
Mhm.
Mayor Elicker?
That just threw me for a loop. I didn't realize it was your birthday, Darnell. That's great news. That's great news. Just real quick, wanted to say very publicly thank you to Director Bond for putting together a very lengthy, detailed, and thoughtful presentation. Having seen the thought that you've put into COVID over the last several years, I have a lot of confidence in your recommendations. To Mr. Golson's point, it would be nice if I think we could say we're going to keep the mask mandate into the end of the year, give people some predictability. But the reality is that this pandemic, every 2 weeks things seem to change, and thankfully the last few weeks things have simmered down some. But I just think it's difficult for us to say with absolute certainty many things. And if there is an opportunity, cases continue to go down. We're seeing them go up a little bit now. If they continue to go down a lot, and there's very, very low risk in the community because we're just not seeing a lot of transmission, that's an opportunity for us to lift the mask mandate. And I think it would be premature for us to say, you know what, we're just going to keep them on for the rest of the year. Although it may be nice for some people to have that predictability, I think we don't want to take it off the table.
Thank you, Mayor Elicker. Mr. Golson?
Thank you, Madam President. I am following the science. I've asked for more science-related information so that we could understand what's going on with this mask mandate. I don't think it's unfair to ask what metric we're using to determine what metric or metrics we're using to determine whether we stay masked or not. I mean, is it the number of hospitalizations? Is it the number of high-risk students? Is it the number of unvaccinated students? I mean, is it a combination of all those? And if so, what does it take for us to get to the point where we won't have masks? Do we have to raise the number of vaccinated students? Then if so, then we should talk about how we as a public school system could help get that number up. Is it to lower the number of students who are high risk? Well, there's nothing we can do about that. Those students are in our school system. They're not going anywhere. We don't expect them to go anywhere. That number doesn't fluctuate. I'm assuming it doesn't fluctuate much from year to year. So that number is always going to stay the same. What is it? What are the metrics that we're going to use? I mean, Mayor Elicker just suggested that one of the reasons why is that we're seeing the transmission rates move up. Well, how much are they moving up? Because we saw a slide there that said the number was up, but it didn't say how many was up. Was it up by 2? Was it up by 2%? Was it up by 50%? We don't see those. We haven't seen those numbers. They're not being broken down for us to understand. And if I don't see it, that means the community that's sitting here watching this presentation is not seeing it either. It also means the press is not reporting it. I'm sorry. You know, if our goal is to increase the number of kids who are vaccinated, then let's talk about that so the press can report it and they can get it out there to the parents. Your kids need to be vaccinated. We can go out and find where these parents are and coordinate with these community groups to get it done. I just don't understand what the metrics are, and that's about science. That's not about rumors. That's not about reading newspaper articles from anti-maskers or anything about that. It's about what is the science? What is the science that we're using to determine that we stay masked? And what is the science that we're going to use to move us towards being maskless? And that's all I'm asking for. Thank you, Madam President.
Madam, I just want to offer a clarification if I can.
Go ahead.
So on the 5th slide, which I will share the presentation, I certainly did share the percentage difference in the last 7 days. So for example, in the last 7 days, we have seen 31 cases per 100,000. That's a 132% increase from the previous week. I also indicated that our test positivity rate is now at 3%. I showed and highlighted the map for the city of New Haven, which is highlighting us in the red. And I also indicated that our hospitalizations are at 23, which is a 100% increase from just a week ago. So I just want to make sure that I have a point of clarification. I also want to add, and happy birthday again, but I also want to clarify that I did demonstrate a number of scientific indicators and metrics that we're looking at. And to your long-term question, I agree with you, Darnell, and we are constant, and I think the mayor or someone also in addition added, this is an ongoing and evolving situation, and we continue to monitor, and our goal is to ultimately protect the health of both the staff at the district working to teach our children and also our children so that they can have a positive learning experience.
Point of clarification, Madam President. This is one of the reasons why we should have this in advance so that we could look at it. I mean, I'm sitting here making comments on a slideshow that went by so quickly and had, I don't know, 15, 25 slides. Okay, thank you. So I'd like to get that in advance. And it's not, and Director Bond, it's not you. I've asked this of every presentation that we've gotten. I've always asked it to get those in advance so that we could have a legitimate conversation about it. And again, thank you all for the happy birthday wishes.
Thank you, Mr. Golson. Director Bond. Dr. Joyner?
I would like to make a motion, but before that, I'd like to make a comment. There have been a number of scientists that were responsible for antiseptic procedures that really changed the world. Hand washing is an example. And based on my understanding of science, I'll probably wear a mask for as long as I live during a time of high infection, no matter what the disease is, if it's the flu or whatever. Because just like washing hands and also other antiseptic or antiviral measures, mask wearing is scientifically proven to limit infections. I'm not going to be careful about the fashion statement of the mask. I just want the protection. But I'd like to make a motion in order to alleviate some of the anxiety in the community. I would like to move that we continue the mask mandate until the Director of Public Health recommends something different. If you want me to make it more specific, I can do that as well. But the motion is to continue the mask wearing mandate in our public schools until the Director of Public Health has given a presentation with all the metrics that would indicate that we should relax those procedures and standards.
Point of clarification, Madam President. Aren't we already doing that? I mean, we made a motion to stay masked, and I'm assuming that we won't change that. We won't change that until we have another motion to go maskless, based primarily on what's coming from our Director of Public Health.
So if that's true, then there's no need for a motion. But we should also be very clear to the community that we will continue to wear a mask if that is true. I don't know right away. then we should continue to wear masks until we have scientific evidence that would justify change. Dr. Tracy, I think, had.
Dr. Tracy, did you have to?
Yeah, from my Dr. Ward is trying to find my raised hand. He's manipulating my thing. We are still under the mayor's mandate or order for mask wearing. From my understanding, the mayor had issued an order for mask wearing that impacts the entire New Haven, including the public schools. And then what was lifted is from restaurants and some other businesses, but it still continues in the public schools. Am I correct, Mayor Elico?
I don't think so.
Yes, you are.
But we voted we voted at our last meeting to keep the mask, right? So that means that we can vote to undo that.
So
I just thought that we
may
would
I clarify?
Yeah, just give me 1 second. I just want to finish this thought. I just thought we were going to be voting today because we had it under discussion and vote anticipated. My thought was, okay, we're gonna be making a motion to continue this or not. Go ahead, Mayor Elton.
So I have an executive order that requires masks to continue to be worn in schools, but as I recall, the board voted to affirm the support of the continuation of that mask mandate. Mr. Wilcox, I see Mr. Wilcox knows everything like the back of his hand, and I see him nodding, so I think I'm correct.
Actually, that's the back of his hand that's raised.
Thank you, Mayor Elicker. Dr. Tracy, did you have?
No, I thought Matt was telling me he's muted. Okay. No, that was just what I wanted to say. Yeah.
Okay, go ahead, Mr. Wilcox, and then Mr. Bolton.
Yes, I was just going to agree with my colleague, Mr. Goldson, happy birthday, and also Mayor Elicker, that we did have a motion to endorse, I believe was the language we used, the mayor's executive order. I think we would have to vote to lift the mask mandate, not have any need to continue it. So yeah, I was just agreeing with that point. I also think that we would not be removing it without strong scientific justification. So regardless, so I don't know that the motion is needed at this time because I think we already have it in place.
That's my fault. Sorry, Dr. Joyner.
No, it's not a problem. We're trying to do the best for our community. So,
Mr. Goldson.
Thank you, Madam President. As far as I know, from my reading of state statutes and the city charter, the Board of Ed is responsible for what happens in the school system. I would love to be able to see a legal opinion on we don't need to debate it tonight. I certainly don't. I'm not asking the attorney to opine on it this evening, but I would love to see a legal opinion on who has the authority to mask or unmask in the school system, especially if the school system is the only part of the community that's actually affected by this executive order. The city hall is not affected by it, I'm assuming. Maybe I'm wrong. Public businesses are not affected by this executive order. We know that they've been unmasked. So I would like to, Madam President, see a legal opinion on who has the authority to mask or unmask in the school system and when that authority can be used. But otherwise, I support the position that currently we voted to stay masked, and we don't unmask until we vote to unmask, so or lift the mask mandate. So I think, all due respect to Dr. Joyner, I don't think there's a necessity to have any sort of motion today, unless we were going to unmask, which I would not support today based on the recommendation from the Department of Public Health. Thank you, Madam President.
Thank you, Mr. Goldson. Dr. Tracy?
Madam President, so in answer to Mr. Goldson's concern a while ago, according to the State Department, superintendent and the Board of Education make such decision in collaboration with the Department of Public Health, our local Department of Public Health, which means that the Department of Public Health has a big say in whether we do or we don't. Thank you.
Thank you, Dr. Tracy. Dr. Jordan?
I'd just like to make a point, particularly since we're a learning organization. If you study the history of scientific discoveries, most of the people who made recommendations like mask wearing, hand washing, and so on and so forth were ridiculed initially. In some cases, there was attempted to kill them. We're not as rational as we think we are. And to me, it really doesn't matter who has the authority. I believe any organization should follow the dictates of science. And I'm glad to see that this board is doing that and that we're working across different organizations to make sure we get it done. And I appreciate every one of you.
Thank you, Dr. Jordan.
Motion detected at the driveway.
Okay.
Madam Chair, I have a hand up. I don't know if you see.
I don't see you, but go ahead.
That's okay. First of all, nothing like masks to have a lengthy conversation, right? So mask mandate remains in City Hall. So Mr. Wilson, just to clarify that. And we had a lengthy discussion, our council, about who has the authority here. In reality, I'm going to follow the health director. I heard several members refer or also kind of say something similar, that they're going to follow the health director's advice. I don't think we're going to be in a situation where we're in conflict here. And to save Mr. Alexiadis some time, because he's quite busy doing a lot of different things, I think rather than have someone write up a formal legal opinion, I don't think we're going to have to cross that bridge. I think we can do this collaboratively in New Haven.
Thank you, Mayor Elicker. Mr. Goldson?
Madam President, I withdraw my request for a legal opinion at this point. Thank you very much.
Happy birthday to you.
Thanks, Mr. Goldson.
Thank you, Mr. Goldson. Okay, I think we can move on to finance and up to, does that conclude your report, Director Bond?
It does. Have a good evening, everyone.
You too, thank you.
Stay safe.
Thank you.
Thank you.
Too. Thank you. Dr. Tracy, does that conclude your report?
Where?
Go ahead.
I didn't know where I was.
Yes.
I think so.
Yeah.
Yes, I think so.
No, we have the approval of the
Oh, no,
calendar.
we have the calendar from the teachers union. In your packet, there are two. The teachers union voted not unanimous, but voted on Friday evening to go with option 2. 2 options are in your packet. They voted for option 2. So now it's for the board to agree to option 2.
Or not. Thank you, Dr. Tracy. Mr. Wilcox?
Yeah, I'd like to make a motion, and that is, I move that we approve option 2 for our 2022-2023 calendar.
Is there a second?
Second.
Any discussion? Mr. Goldson? Mr. Goldson? Oh, you're muted, Mr. Goldson. You're muted, Mr. Goldson. You're muted.
Thank you, Madam President. I'm not sure if I've looked through my package twice. I'm looking through it a third time now. I don't think I've seen the calendar choices. Could you tell us what's the major differences between the A option and the B option?
Hold on, I'm trying to find it, all of them. Hold on, Donna. Okay, so option 2 begins August 24th. That's before Labor Day, and then we would end June 14th. Option 1 begins August 24th, and then we will end June 20th, which we can't really end June 20th because that's Juneteenth day. But that's what it is right now. So we're ending earlier. We're starting earlier in August and earlier in June.
I think I just heard you say both start dates for both options was August 24th. Maybe I heard that wrong.
No, and yes, both start dates are the same, August 24th, but the end dates are different.
And the February break.
And the February break is different. In option 2, it's just basically a long weekend.
So
And
there's
in the other one, yes.
so there's a longer February break in option 2.
Option 1.
Option 1. So option, yet there's a shorter break in option 2, yet we're going 6 days longer. So could you explain that to me? I don't understand.
We're not going 6 days longer. We're ending June 14th.
You said option 1 was June 24th and ending June 14th. You said option 2 was starting June 24th and ending June 20th.
Yes.
Is that correct?
Yeah.
No, it's not.
Okay.
Option 2 ends June 14th.
Got it.
Based on the calendar I have in my hands.
Okay, got it. So the option that you're asking us to approve is the option that was approved by the union is the option that has less days out in February and ends earlier in the year.
Yeah, that's what the teachers.
Got it. Okay. Thank you very much, Madam President.
Thank you, Mr. Bolton. Attorney Alexiadis was feverishly waving his hand, so I'm nervous about this now.
Well, I just wanted to point out that the calendar options are posted with the other materials on the board website for tonight's meeting, beginning at I think page 24 of under the other materials link, so y'all can look at them. That's all.
Thank you, Attorney Alexiadis. Dr. Joyner?
Madam Chair, this is germane to calendar. I think we need to help the public understand that this particular calendar is based on our relationship with our unions and what have you. But I do hope that we can have on our broader district calendar a recognition of Italian heritage. If you remember when we made some changes in the past, I think that in our spirit of honoring diversity and what have you, that we ought to make sure that that's in a prominent place in our materials going forward, as well as other things that may come up. So I just want to say that for the record.
Thank you, Dr. Joyner. Mr. Bolton?
I'll thank you, Madam President. Is Dr. Joyner suggesting that there is no Italian Heritage Day related holiday on the calendar at this point? That's my first question. The second question is that Muslim holiday that we approved a year or two ago, is that on the calendar this year?
April 22nd. Yep.
So the answer to my second question is yes. Is there an answer to the first question?
Are you asking me?
Well, I'm asking whoever knows, whether it's you, Dr. Joyner, or anybody else. You suggested that there might not be that on the calendar, and I'm wondering if that's true or not.
Yeah, that would be good if we could find that out so that we can put that to rest.
Mr. Wilcox has his hands up, so he may have the answer to that question.
Mr. Wilcox?
Thank you. Yes, it's listed. What's listed is the Indigenous Peoples Day count on October 10th, and not Italian American Heritage Day or Columbus Day. So it's listed only as Indigenous Peoples Day.
Yeah, and can I answer
board action?
And Madam Chair, can I answer that? Because I'm glad Mr. Wilcox brought that point up. Some of you may know that President Obama was the person that actually sign a decree to issue, I believe it was Italian Heritage Month. And so when we changed the name of the school, we omitted to do anything to keep Italian heritage prominent in the memory of people in this community, many of whom made tremendous contributions to New Haven and to the country at large. And I think we ought to decide that we're going to honor that contribution. And actually the federal decree was a month, I believe. I can look it up real quick. But we ought to make sure that we put that issue, that we do the right thing regarding that issue as soon as possible.
Mhm. Thank you, Dr. Jordan. Mr. Wilcox?
I was just going to say, we have in the past discussed having some sort of listing of kind of the official, months of the year that the district, kind of as guidance for people, so they're aware of them. I know that, obviously there's, especially when you start looking at particular days, there's thousands of them, it seems, but certainly the short list of listing, Black History Month, Italian American Heritage Month, etc. I think that would be great. We've just talked about it before. If the district produces that, it'd be nice if we could have it maybe later attached to this. But I'm perfectly comfortable voting for this calendar now as it is, particularly since it's also been endorsed by the teachers union, which by contract they have we have to agree with them on this calendar. So right. Thank you.
And by the way, it was President Bush, not President Obama.
Thank you, Dr. Jordan and Mr. Wilcox. Mr. Goldson?
Thank you, Madam President. I got to say I'm a little disappointed that this issue hasn't been resolved. I thought the board and the administration had committed when we changed the name of that school and we changed the name of on the calendar, and we changed the name on the calendar, that we were going to commit to make sure that community was protected. And I'm saying this because I would want the same for my community. I would not want someone to eliminate MLK Day and not acknowledge our community. So I'm a little disappointed that we haven't done that. I understand that this is a process that is a joint process between the board and the union, and we pretty much got our backs against the wall now at this late in the process. But it's frustrating. It's very frustrating to be able to have to sit here now and have to vote on a calendar that has not addressed that issue. We've had more than enough time to do that. We've had more than enough conversations around doing that, and the fact that it hasn't been taken care of, for me, is disappointing and frustrating that I have to vote to approve this calendar today without consideration to what we talked about doing for that community. Thank you, Madam President.
Thank you, Mr. Golson. Mr. Wilcox?
Yes, Madam President, I was just going to confirm we do have a motion on the floor, if I remember correctly. So when we're completed with that, I will be making a motion that we charge the governance committee to add this to their agenda and come up with a resolution of this so that we can use our committee processes and move away from talking to the doing. So thank you.
Thank you, Mr. Wilcox. Dr. Jordan?
Madam Chair, I think there are some differences between approving a calendar that has in it contracted holidays and so on and so forth, and approving a month that has already been designated by President of the United States. And I think that they are slightly separate matters. We could approve the calendar, and then we can follow that with a motion to, I believe, make October, in concert with the federal move made by President Bush, to make October Italian Heritage Month. That's the way it's done all over the case. So one calendar is really kind of like legal holidays that have been approved by the union. And the other calendar is what the district is doing to make sure it honors the achievements of all of its citizens. So I think that we can do both. And I don't think we have to wait if we're willing to vote to make October Italian American History Month in concert with what the White House did years ago to do the same. And we can go to Pepe's and we can go to Worcester Square and we can do all those other things and we can hang out with our friends and learn a great deal about Italian heritage and all that Italians have contributed to American life and society. So I think there's certainly different efforts. And I think we can approve the calendar and I think we can do that as well tonight.
I agree. I just think we have to maybe look at dates, have Dr. Tracy look at that, because I think that Hispanic heritage goes from like mid-September to mid-October. I'm not sure.
They can overlap.
But they can
actually overlap.
I don't know. Yeah, I don't know how that
we should be celebrating everything on one particular day. They can overlap.
Mr. Golson?
Thank you, Madam President. I would tend to lean in the direction of Mr. Wilcox's suggestion. I think if we really should include representatives of that community in the discussion. I think that could happen through the committee process and Ms. Benitez, Dr. Benitez, and the governance committee. I wouldn't want to. I mean, I don't know what their community wants, right? I don't know what the representatives of that community want. So I would rather hear recommendations from them around this issue than to just kind of base our decision based on something that President Bush did, I don't know, 12 years ago or 16 years ago, whatever it was. So, and again, we could then address these issues of overlapping months and so on. So I would be supportive of Mr. Wilcox's suggestion that we forward this to the governance committee and let them go through whatever process they need to go through to make recommendations to the full board. Thank you, Madam President.
Thank you, Mr. Golson. Dr. Joyner, do you have your hand up again, or was that from before?
Yeah, I do. I have a large constituents, a group of Italian Americans, as well as family members or whatever, and I've talked to all of them. But I'm willing to accept Mr. Golson and Mr. Wilcox's just to make sure, the recommendation just to make sure. But I think we should get it done within the next 30 days because it's been too long. And it's not hard to do that.
Wow, Dr. Benitez.
Thank you, Dr. You're in the hot seat now, Dr. Benitez.
Oh, she can handle it.
All right, we have.
Yeah, I will. I'm sure.
Thank you, Dr. Benitez. All right, so there's a motion on the floor, properly seconded. I don't see any other raised hands. So we will vote on accepting the 10-month calendar option 2. Mr. Wilcox?
Yes.
Dr. Joyner?
Yes.
Dr. Benitez?
Yes.
Mr. Golson?
Yes.
Dr. Yarborough?
Yes.
Mayor Elicker?
Yes.
And I am a yes as well. And so option 2 passes. And so we'll move on to Mr. Wilcox.
I'd like to make a motion, and that is I move that we refer the question of the supplemental calendar to the governance committee with the request that they get back with recommendations to the board by our first meeting in June.
Second.
Properly seconded. Any discussion? Seeing none.
I'm sorry.
Oh, go ahead, Dr. Benitez.
Yeah, I need to make sure that my colleagues send me what it looks like, what a supplemental calendar looks like. I'm not sure what that looks like. So as we approve this, I need some guidance. Then I can get it done.
Thank you, Dr. Benitez. Okay, seeing no further discussion, Mr. Wilcox,
Yes.
Dr. Joyner,
Yes.
Dr. Yarborough,
Yes.
Dr. Benitez,
Yes.
Mr. Goldson,
Yes.
Mayor Elicker,
Yes.
and I am a yes as well. So that motion passes. And we can move on to finance and operations, Mr. Wilcox.
All right, thank you very much. Before I make a motion to move these items, I need to note a correction to an amount on agreement number 4 with the Modern Classroom Project. It's currently listed as an amount of $30,000 and the correct amount is $6,000. So I'd like to thank Dr. Yarborough for catching that mistake and for Dr. Tracy for confirming it. But so the correction to the amount is for agreement number 4 is not 30,000, it will be 6,000, so a reduction.
Point of order.
Yes.
Since this is under $20,000, why would it not be just included under information only?
The reason is that it's actually agreement number 4 and agreement number 5 are part of the same arrangement with the Modern Classroom, but it spans over 2 fiscal years. So the amount in this fiscal year is 6,000. The amount in the next fiscal year is 24 for a total of 30. And so that was the reason why it was brought to the F&O this way. And then we split it there because of the split fiscal years.
Thank you for the clarification.
Certainly. So with the correction noted, I'm going to make a motion, and that is that we accept the 7 agreements with the correction noted to number 4 and the 2 change orders as listed on our agenda.
I second that.
Okay, got it.
Dr. Yarborough, any discussion? Okay, seeing none, we'll vote on the F&O items mentioned. Mr. Wilcox,
Yes.
Dr. Yarborough,
Yes.
Dr. Benitez,
Yes.
Mr. Goldson,
Yes.
Dr. Joyner,
Yes.
Mayor Elicker,
Yes.
and I am a yes as well. So F&O items pass. Don't see the students on. So I'm guessing we're gonna skip the, Ms. Mason, do you have a question?
Yes, I need some clarification. The motion that just went through, is there, are there 2 motions, one to amend and then another?
No.
To move on another motion?
No, it was just a correction that was made on the figure for agreement number 4 to bring it from 30,000 to 6,000. And then it was, the motion was just to approve the 7 agreements and the 2 change orders.
With the correction.
With the correction, right. So it's not, it wasn't 2 motions.
Okay, thanks.
Okay. No students report, I'm guessing. Staff don't have a student report. Teaching and learning, Dr. Joyner.
Yes, I'm going to ask Mr. White, Dr. White rather, to put my screen up. Please. Do I see him? Well, yeah, I see him. Over the next 3 board meetings, I'm hoping that the teaching and learning committee can help our community understand that teaching and learning is really throughout the community, throughout the school. And it's really a product, the atmosphere that promotes teaching and learning is a product of the efforts of adults and children. We all are responsible for teaching and learning. And so I'm going to start with our staff and our board in terms of the kind of people that we need in order to make this happen, and the kind of behavior that we need from people to make this happen. Everybody likes to quote, "It takes a whole village to raise a child." But I think most people who pay attention to the news today will know that the village is not as whole as it used to be. And that if we're going to make a difference, particularly in these troubled times, we all are going to have to step up our games regarding to behaving in ways that will lead us to the accomplishment of our goals. And so I'm starting with the board and the staff, and I'd like to ask Mr. White to move the next slide because our hiring standards are very important. So in part one of this presentation, I'll talk about factors in recruitment, hiring, and retention of staff and standards for the board. In part two, I'll talk about student behaviors associated with school and life success, effective parenting behaviors. And in part three, I'll talk about effective school and community engagement practices. I'm not the last word on this, nor am I the first word on this, but I do believe that a collaborative dialogue and a no fault, and Abby knows exactly what I'm talking about when we talk about no fault problem solving approach can move us to a greater achievement on the part of our kids. So let's go to the next slide. When you look, there are several factors that any good organization looks to in order to set a standard for how they hire people in. And the first thing is that if it's a certified position, the person has to have certification. All of our teachers and our psychologists and all of our state certified people have to be certified in order to work for us. And it doesn't matter, nothing else matters unless they meet that certification. And of course, that's true in the education field, it's true in medicine, it's true in law, finance, and it's also true in the trades. The second factor is competency. And obviously the people have to have professional knowledge, skills, beliefs, and motivation related to the ability to perform the work. And sometimes you don't know whether the person is competent until they've worked in your organization. Certification does not necessarily presume competency. And that sounds a little bit paradoxical, but anybody who's run a school or run a municipal organization can tell you that people can be certified in a particular field and not be as competent as the certification would suggest. And that's why you have medical malpractice. That's why you have legal malpractice. That's why you have craftsmen come to your house and botch up a job. That's why the doors didn't work at ESOMs and all that other stuff. And so it's critically important that the person be competent. That's why your evaluation systems are important. But more important than anything, you can be certified, you can be competent, but if you don't practice moral excellence and firmness in meeting your duties and responsibilities, it all goes for naught. We see that the world is in trouble right now because of evil characters. And evil characters are typically responsible for almost all the trouble in the world, historically and in the present. Let's go to the next slide. Commitment. You know, you have to have a special commitment to work in certain environments. And I like to say publicly that the teachers in our public school district are among the most committed people anywhere. And many of them meet all the other criteria, and they still refuse to leave the system when they're offered maybe more lucrative opportunities in teaching or whatever. But that doesn't mean that if I had another C up here, it would be compensation. Doesn't mean that we shouldn't work very hard to make sure that they're adequately compensated. And I believe every single person on this board is willing to do that if we can find the resources. The third one is cognizance. The second one on this sheet is cognizance. You can have all these things, all the other things, but if you don't know where you are, who you are, where you're working, who you're working with, and the factors in their lives that influence them. And if you don't see the cause and effect relationship, for instance, the causes between poverty and reading scores, the causes of poverty and early entry readiness for school, that's real. And there's a scientific basis for that too. I don't have the time to go into great detail about it, but almost everybody is raised on a continuum of 3 environments: deprived, standard, and enriched. And people raised in enriched environments start out with a better chance at life. People raised in a standard environment have certain advantages, but people who are raised in a deprived environment are threatened biologically, they're threatened cognitively, which is a biological product. They're threatened emotionally. Some people are born in hell. And all you have to do is think about what you already know about poverty. And also just think about the images you've seen on television with what's happening in Eastern Europe. And think about what that's doing to those children. And you can also think, if you know anything about history, about what happens when people are subjected to things like that for 300 years. It's real, and it has biological impact. And so I know that we talked about some of the stress hormones that come out, but they don't just come out in school. They don't take a day off. Anything that goes on in your environment that's stressful, whatever time and place it happens in, has an impact on you, which means that you have to be aware that if you're an urban educator, if you're an urban parent, if you're an urban worker, that you have to rise to higher levels of commitment and performance than if you were in a situation where the kids came to school without the disadvantages that many of our children and many of our parents bring. It really is generational. And I'll be talking about that in the next board meeting. Could I go to the next slide too? I gave myself 10 minutes. Courage. Some of the greatest gains in school reform have come about because people stood up and they had the mental and moral courage to confront, persevere, and withstand danger, threat, fear, or difficulty in trying to carry out their responsibilities. When I first came to Hill House in 1970, the students were rebelling against a counselor that would program Black children and brown children not to apply for college, no matter how bright they were. But that's an American tradition, unfortunately, and to some extent it has happened to immigrants as well. But there are people in this country who have been legislated against, and this person harbored those prejudicial assumptions about the potential of kids. One of the students in question now has 2 doctorates, one in economics and one in theology, which is a nice combination. So it's not just enough to be competent, to be certified, to be cognizant. It requires that you have the courage to do your research and to try to right wrongs and to try to do it in a way that will get you your results. If the only thing you can bring to a problem is anger, then that's not very helpful. And then, of course, the last one is a diverse workforce. And I know that attorney alexitis was taught in law school that every word counts in text. And I want to make sure that I emphasize a particular word in this statement, that as a board, we're a group of policymakers, and the rest of the district are a group of employees who are culturally, socially, and professionally competent enough to serve the needs of human beings across the spectrum of human diversity. And the key word for me here is service. And when we talk about diversity, we're talking about age, because I'm in that group now. And I don't want to be discriminated on the basis of the fact that I have lived on earth for 3/4 of a century. I still have a sharp mind. I'm still as strong as most 25-year-olds. And I don't want people looking at me and say that old guy can't do this or can't do. There's some things the old guy can't do, but there's some things that the old guy can do. A socioeconomic background. Sometimes we say that we want people to look like us, but I had people that looked like me that gave me some of my biggest problems. Because even in the segregated schools in the South, people were discriminated on the basis of socioeconomics and complexion. That's real. And it's in the historical record. culture, physicality. People are discriminated because they're heavier, or short, tall, all kinds of things. Race, religion, gender, and sexual orientation. We have to be a workforce and a group of policymakers that represent and serve the needs of all of those differences. And I believe with all of my heart that this board does that. And I believe that the great majority of the people that work in the system do that. And I also believe that we have a system in place for recruiting, hiring, and retaining those people. And we also have a system in place to make sure that they live up to those ideals. My 10 minutes has expired, the 10 minutes I gave myself, but I'll just sum it up with this. What I've laid out tonight are the kinds of qualities and standards that we have to live up to as a board and as a staff. What I will be doing at the next board meeting is laying out the standards and behaviors that students and parents and community members have to do, because you cannot expect the board and the staff to do the heavy lifting. We talk about reading programs. If we only talk about what the programs say can be done, and we don't talk about what people have to do to benefit from them, then we've missed the boat. And so I'll be talking about that in greater detail at my next presentation. And I thank you especially the president. And you know why I'm thanking you. And Dr. Tracy for the opportunity to present this, because I think that it will give us an opportunity to help the community understand what we need from them in order to make this work. And we have to help kids understand what we need from them in order to make this work, as well as the community. Thank you.
Thank you, Dr. Joyner. Questions or comments for Dr. Joyner? Dr. Tracy, Dr. Yarborough?
Dr. Yarborough had been up almost the same time right now. So I just want to say that, thank you, Dr. Joyner, for that presentation. You live every day and you learn every day. You're always teaching. Thank you for sharing the information with us, and it's something for us to continue to explore as we work through the hiring process that we're going through. I just want to say on the eve of that we have a flyer being sent out to the board and to others about our upcoming recruitment, and we'll make sure we bear some of these things in mind as we continue to recruit for our school system. So thank you. That resonates a lot with me, and I'm sure with other staff members and with the board, of what you just shared. So don't give up, continue your teaching. Someone will listen. At least I'll listen. Thank you.
Thank you, Dr. Tracy. Dr. Yarborough?
Yes, also want to thank you, Dr. Joyner, for sharing the information and also just painting a roadmap. I think a lot of times, especially with my generation, there's a full menu of options, but not always a map for how to move forward. So I thank you for clarity on the board level for who I can be as we work to be the school district that we can be, the excellent school district that we can be. And I look forward to the other steps that you will share in future presentations, because in addition to be a board member, like many of us, we wear additional hats as community members or parents, business owners, and we get an opportunity to really support not just our own children or my own child and family and godchildren, but the other children in our community and the parents and staff and teachers as well. So thank you very much.
Means a lot.
Thank you, Dr. Yarborough. Okay, Dr. Tracy, Superintendent's report.
Okay, thank you, Madam President. This evening, some principals were to present what's going on in their schools. They will do so at the next upcoming board meeting. But just for me to share that we have seen an uptick in COVID-19 cases. Solidified by what Dr. Director Bond presented. We saw 26 cases last week. So at some point we were 5, we were 16, 19, now we're up to 26. And just for today alone is 7 cases. We just started school today and it's 7 cases. that we have seen just for today. So there's an uptick in the virus in our schools. We have sent tests to all schools to be distributed to staff and students, 2 kits to be given to each staff member and each student, so that we're hoping that after the April break is next week, after the break, that they'll be able to at least test themselves with these rapid tests to see where they are, so that we're not coming in back with a lot of folks infected after they intermingle with others on vacation or in the community. We continue to work in collaboration with the health department, and that is important for us to make sure we continue to do that and use the information that we glean to guide our decision making. Read Across tomorrow in New Haven launches tomorrow at Wexler Grand School Auditorium at 10 a.m. We have students were selected by their schools as ambassadors for reading. We have some busloads of students who will be coming to Wexler Grand as we kick off Read Across New Haven. This is important to us. We know that reading is a very important foundational subject for our students. And so we are pushing that, encouraging our students and our families to read with their students, to enjoy independent reading, whether it's picture reading or, shared reading or oral reading, whatever it is, the type of reading that our students are engaged. Along with that, as I had shared with the board, we are investing in home libraries for all our students, all 20,000 of them home libraries. That is cost so much, but we believe that was good spend of our federal dollars, which talks about acceleration of learning. So we want to make sure that that goes in the hands of students, so that to inspire love of and a love for reading. Obama official opening will be May 1st, 2022 at 11 a.m. The invitation is coming out shortly to all board members and other dignitaries that we had from last year. Our science fair, and I'm going to send this to you as a reminder too. Our science fair is coming up in April, I think it's May 18th, but this time it's going to be virtual. Many of our schools are engaged in virtual and in-person science fairs at their schools right now, but the major district-wide one will be on the 18th and it will be virtual. And of course, the last day of school for this year is June 23rd. We had to make up a day because we had gone over one extra snow day. And so we have to make up that day. So we end on June 23rd this year. The exam schedules have been given out to schools. And we're doing early dismissal for high school during that week as they do their exams. Graduation for high school, 2 days in June 16 and 17, and the school decide which of those days they want to select. And grade 8 promotion is June 21st and 22nd. We also are celebrating again this year, Juneteenth. SBA testing is going on right now. They gave us a wide window of time to do our SBA testing, which people call SBAC testing, but it's really SBA testing. So that is going on in many of our schools right now. Schools are encouraged to have assemblies for students and to start welcoming parents back into their buildings. We have to live with the virus and at the same time exercise caution via mask wearing and hand sanitizing. We're already planning for next school year, looking at where we are, some of our accomplishments this year and where we need to move. We already started examining our strategic plan to see where we are, taking stock and what we need to tweak and move forward into year 2023. And so that's where I am in terms of my quick update for this evening. Thank you very much for listening. I'll send it to you so that you can remember what I just said. I know you're not going to remember all of those, so I'll send this to you. Thank you.
Thank you, Dr. Tracy. Questions or comments for Dr. Tracy?
What was that?
No, I asked if there were questions or comments for you from the board members. Can you hear me, Dr. Tracy? All right. See.
Oh, and Madam President, I forgot, it slipped me inadvertently to announce that we have 2 administrators who are retiring, Richard Therian, Timothy Weisel. They're retiring from our district after several years of service. We have 2 teachers who are retiring also, and 2 paraprofessionals who are retiring. 3 paraprofessionals. 1, Larry McDonald, has been with us, non-instructional staff for several years, working in technology. He's also retiring. So I forgot they would get after me if I didn't share that. So I have to back up and mention that. Thank you.
Thank you. Congratulations to them all. Dr. Yarborough?
Yes, I want to thank the professionals of our school district who are retiring. Thank you for your service and what you've modeled. And just thank you so much for that dedication to this district. And Dr. Tracy, I just want to thank you for your reading initiative. And I think this underscores, Dr. Joyner's point about a collective effort around reading. So just getting out in the neighborhood, the community, the excitement, the energy around the role that each of us have to read, not only in school, but also in our homes. And as you describe this initiative, I also think about what you did during the pandemic in terms of exercise and getting outside and walking up mountains and hills. I said, Dr. Tracy's doing that? I said, no, show me the photo. Show me the photo. I want to see it. But I saw the photo. You were doing it. So just thank you very much for your energy and and being out there. So thank you for your example, your leadership in that.
Thank you, Dr. Yarborough.
Thank you. That ends my report.
Thank you, Dr. Tracy. For President's report, really quick.
I'm sorry,
Joyner had his hand up.
Madam Chair.
Oh, I can't see you down there, Dr. Joyner.
No, I'm down there. I'm up here on mine. I just don't think it is proper for me to not say anything about Dr. Therian. For the time that I chaired the TL committee, he played a large role in organizing the meeting and what have you. And I think he's one of those persons that sometimes can fly below the radar. I just found out he's a wedding singer as well. I didn't know he was a singer. And I hope he doesn't have a Tom Jones outfit. But anyway, he is a throwback. He's a gentleman. He's a scholar. And I call him Richard the Kind-Hearted because he's a very kind man. And I feel sad that he's leaving. But, you can't stay in one place forever. And I just wish him well as he moves on to his next level. Hope he doesn't forget about us. Hope he'll come back every now and then. But he did some great things in science. And I'm hoping that we can find a suitable replacement for him. He really is a wonderful human being.
Thank you, Dr. Joyner. Okay, moving on to the President's report. No hands this time. Really quick, we had our second half of our retreat that happened on April 6th. Ms. Fran Rabinowitz was our facilitator, and we discussed superintendent versus board roles, also our goals, and the minutes should be posted on our website so you can look at it there. And Head Start report, Mr. Wilcox.
Thank you. This will be brief. Our next meeting is on April 21st. One thing I do also want to inform the board is that we did receive the official notice that the Focus Area 2 review by the Head Start office, home office, I guess, or regional office, will be happening the week of May 23rd. And just as a reminder, this Focus Area 2, it's going to be done, I believe, on Zoom, but they're going to be taking a look at how we're setting up things. They're going to be reviewing documents related to needs assessments, looking at our fiscal policies, classroom fiscal analysis, and so on. So something that that team will be working on to be ready. They've been working on it. So unfortunately, it's been, we thought this was going to happen earlier this year, but it's now been scheduled for May 23rd, week of May 23rd.
Thank you, Mr. Wilcox. Any questions, comments? No. All right, Citywide School Building Committee report.
For
Mr. Wilcox?
citywide, I'll just mention our next meeting is this coming Thursday. And one of the standing items on the meeting is security concerns. It's part of the report that will be presented and will be posted on the website. Which would include things like doors. We'll be doing that this Thursday at 4:30 p.m.
Thank you. And finance and operations.
For finance and operations, a big pertinent piece of information was the financial forecast, which was posted, and the administration is now currently projecting a shortfall of just over $1.9 million, which is down from, I believe it was 4.9. So Ms. Hannons and her team are hard at work with the mitigation efforts. And so that was a major piece of information that was there and was included in our packets and is posted on the website.
Thank you, Mr. Wilcox. Okay, governance report, Dr. Benitez.
Yes, good evening. Just an update on the K policy manual that we authorized Ms. Jackson acquire. She will be meeting with Kate during the April break and making sure she's going to start working on how we can implement the manual in the use for our own policies. And just a clarification, most of our policies, even when they are not recent, are not necessarily outdated. So this will be just to make sure that those that are outdated are made up to date, and any language that may need to be cleaned in those that are up to date but may have changed in some way language because of time and contextual realities that change in our society and how language changes. The other thing that we discussed is how the process for the transgender and gender non-conforming guidance document. This is something that accompanies one of the policies that the board already approved that addresses the LGBTQ plus community. There's a task force that has been working on this. They have also shared this guidance document with them, in addition with the New Haven leadership team and the principals. Something that also was shared with the committee was that by Ms. Joseph Lumpkin is that sometimes we have the policies, we have the guidance documents or the plans for implementation and training that is needed for implementation, and that may take longer than the staff at times would desire. But in order to do a good job at training people and doing what they need to do correctly, it might take us a little bit longer. I think it's something to perhaps for the staff, the leadership team to discuss and see how they can streamline the time constraints. I understand we cannot keep administrators too long and take them out of buildings too many times, but you might want to discuss that when it comes to certain implementation, such as our restorative practices. The other thing that I wanted to share with all of you is that after our discussion at the last board meeting, where we talked about the importance of coming up with a statement that would support support students in understanding how they use language, or in understanding how they may or may not be engaged in practices that may stress inequities. When we discuss it in committee, we do have policies that address equity and discrimination. And what we thought is important is that we then look at those and create sort of guidance materials also for our administrators to help their learning communities. We also discussed that perhaps Ms. Evie Velasquez, and I hope you were told this, Ms. Velasquez, could come to our next meeting so that we can discuss how the district equity leadership team policy may support this conversation. Again, the committee is very, very engaged in a conversation about this, but does not want to duplicate things that we already have in place. We just want to make sure that we support the staff in training the rest of the school, the district community. Also, Ms. Jackson and Ms. Owen will be working on policies concerning homeless youth, and will reach out about including a guidance document. So we do have quite a bit of things that we're working on, but everything requires that we look at guidance documents so that the staff can use it in training and in helping staff implement those policies. Thank you. I have to excuse myself a little bit. I have a cold because I wasn't wearing masks, and my first cold in 3 years, but or 2.5. But so I apologize for my voice and all that.
You will find Dr. Benitez. Thank you. Any questions or comments for Dr. Benitez? As I sit here coughing myself. No? Okay. We'll move on to the food service task group. Dr. Yarborough.
Good evening. Our food service task group will meet this coming Wednesday, and the team really has a high caliber collaboration across the district, and including state partners, federal partners, with a pop-up food pantry that will happen Tuesday, April 19th. And there are flyers that have been distributed, and also other communications that have gone out or will go out. And the locations are the Truman School, Wexler Grant, Brennan Rogers, John Martinez. And we're really grateful for the collaboration for those who are putting this on, for the community that will come. And we look forward to really serving food gap that happens during our breaks, our recess from school. So that concludes my report. Thank you.
Thank you, Dr. Yarborough. Any questions or comments for Dr. Yarborough? Okay, seeing none, I will move that we go into executive session for discussion of confidential attorney-client privilege memorandum proposed to be held in executive session pursuant to sections 12006E and 1210B10 of the Connecticut General Statutes. For a second. Second. Thank you, Dr. Benitez. Any discussion? Being none, we'll vote to go into executive session. Mr. Wilcox.
Point of order, Attorney Alexiadis is raising his hand.
Attorney Alexiadis?
Madam President, you should specify the attendees, which I would suggest include Attorney Rebecca Goldberg, who has been listening in and is prepared to join us in executive session, myself, and Dr. Tracy.
Thank you.
I think that covers it.
Yeah, and I will, so I'll invite to executive session, Dr. Tracy, Attorney Rebecca Goldberg, and Attorney Alexiadis. Is there still the second, Dr. Benitez? Or is there a second?
Yes.
Thank you. Okay, so we'll go into executive, to go into executive session. Mr. Wilcox,
Yes.
Dr. Joyner,
Yes.
Dr. Yarborough,
Yes.
Dr. Benitez,
Yes.
Mr. Goldson,
Yes.
Dean Elicker,
Yes.
and I'm a yes as well. And the link was sent by Ms. Hammonds. Red Hammonds. Many of us got lost in transit. I'm gonna give them a few more. Let me give them a minute to come on. If not, there's enough of us to. There we go. Okay.
Who's missing? Dr. Joyner?
And Dr. Benitez, I wonder if they thought the meeting was over and they're gone.
Oh, we have a
Oh,
quorum.
there's Dr. Benitez.
We have a quorum.
I move that we adjourn, Madam President.
I'll second the motion.
Well, wait. Don't I have to legally say that we're out of executive session? And in
Yeah,
regular
whatever.
session?
Go ahead.
So we're out of executive session, back in regular session, no votes were taken in executive session. And so if there's no further discussion, I will entertain a motion to adjourn.
I move to adjourn, Madam President.
Second.
Second, thank you. So we'll vote to adjourn. Mayor Elicker,
Yes.
Mr. Wilcox,
Yes.
Dr. Joyner never made it back, Dr. Yarborough,
Yes.
Dr. Benitez,
Yes.
Mr. Goldson,
Yes.
and I am a yes as well. Good night, everyone.
Good night, everybody.
Thank you.
Night.
Thank you.
Good night.
Birthday, Mr. Golds.